Battlefield Medicine, USA. World War II examines how American military medics transformed emergency care under the extreme pressures of global conflict. As with our videos on the Civil War and World War I will ask Jen Williams, the founder of Kidney Contenders, specific questions related to the medical innovations and frontline realities faced by U.S. personnel. The war forced rapid advances in trauma treatment, evacuation systems, and surgical response close to active combat. These breakthroughs reshaped modern emergency medicine and defined the future of battlefield care. Where did American troops see the most intense combat during World War II? Which regions became the defining battlegrounds for U.S. forces overseas?
U.S. forces fought in Normandy, Bastogne, Arnhem, and across France. They fought in Belgium, Luxembourg, and Germany. So the major operations included the Normandy landings, the Battle of the Bulge, and the push toward Berlin. These campaigns, they required coordinated movement through Western Europe cities, through their forest and their rural terrain. Now, when you look at the map of the Japan and Pacific, so that was the map of Europe, but if you look at the map that we have for Japan and the Pacific Islands, the U.S. forces fought in Tokyo, Osaka, Sapporo, and across island regions, including Guam, Palau, I think it's how it's pronounced, or Palau, it's spelled Palau, Micronesia. And so the major battles occurred in the Philippines, Okinawa, and Iwo Jima. So the Pacific campaign actually required amphibious assaults and sustained operations across remote island chains.
What kinds of terrain made combat especially difficult for U.S. troops? How did those conditions test their endurance and morale?
So in Europe, U.S. soldiers faced dense forest, freezing winter conditions, and muddy fields across Belgium and Germany. Now, urban combat in Normandy and Arnhem, they required navigating rubble, destroyed roads, and fortified positions. So the varied terrain demanded constant adaptation to cold, wet, and obstructed environments. Now, in Japan and the Pacific Islands, in the Pacific, U.S. soldiers endured tropical jungles, volcanic rock, steep mountainous terrain across Okinawa and Iwo Jima. So you had heat, humidity, and monsoon rains created hazardous footing.
Jen, how did the environment itself lead to medical problems for soldiers? Did climate or geography create unique health challenges?
So in Europe, cold exposure in Bastogne led to frostbite, trench foot, and hypothermia among U.S. soldiers. Mud and stagnant water increased infections, including cellulitis and gangrene. Urban debris caused fractures, sharp nail wounds, and crush injuries during city-based combat. And then over in Japan and the Pacific Islands, so the Pacific heat and humidity caused dehydration, heat exhaustion, and fungal infections across Guam and Palau. It's either Palau or Palau. It's spelled Palau. Dense vegetation, for example, that actually increased malaria, dengue fever, and insect-borne diseases. The volcanic terrain produced severe burns, laceration, and actually embedded debris injuries. So none of it was, these medical conditions that were caused by the terrain were just hideous.
What emergency procedures were most common on the battlefield? How did surgeons adapt when supplies or facilities were limited?
So in Europe, surgeons performed rapid wound debridement, fracture stabilization, and emergency amputations for frostbite and crush injuries. Blood transfusions and plasma therapy were used widely in France and Germany. You had field hospitals near Normandy, and they provided triage, surgical intervention, and postoperative stabilization. And then over in Japan and the Pacific Islands, so you had the Pacific surgeons that treated the burns, the blast injuries, and the tropical infections using debridement, sulfa drugs, and intravenous fluids. Emergency airway procedures were common due to smoke inhalation and volcanic debris. Mobile surgical units supported operations across Okinawa and Iwo Jima. And those were pretty much the medical procedures that were performed by U.S. surgeons.
Jen, what major medical innovations emerged between the Civil War and World War II?
By World War II, I'm trying to think how to phrase it, advancement in U.S. medicine between the Civil War and World War II. So by World War II, U.S. medicine had advanced from Civil War practices to include antiseptics, anesthesia, and organized triage systems. Blood banking and plasma distribution were major improvements used across Belgium and France. The surgical techniques became faster, safer, and more standardized. And then over in the Pacific, you had advancements that included antibiotics, improved wound care, and portable surgical units. So evacuation systems overall evolved from Civil War wagons to actual air transport from islands like Guam and Palau. It's either Palau or Palau. I think it's Palau, but again, it's spelled Palau. But the medical logistics supported sustained operations across remote island chains. So there was a vast difference from when U.S. soldiers, when men were being treated in the.
How did these wartime lessons shape modern military health care?
Overall summary of battlefield medicine in World War II. Yeah, I mean, there were so many battles, but I would say that the battlefield medicine in Europe required rapid response to cold injuries, sharp nail wounds, and urban combat trauma. Surgeons operated under extreme pressure with evolving techniques and limited resources. But despite the challenges, you did have the medical teams that saved thousands through organized triage and improved surgical care. And that's a really big reference point right there, improved surgical care. Now, in the Pacific, the battlefield medicine confronted tropical disease, heat injuries, volcanic terrain, trauma. I mean, it was really bad. And medical teams, they had to adapt. So the medical teams adapted to remote islands with mobile units and innovative evacuation methods. Their work demonstrated resilience, coordination, and significant advancements in U.S. military medicine.